My name's Dr. Ryan Brosch. I'm a physician that works with Women's Care Florida over in Clearwater and Pinellas County. My medical training was for medical school was at Florida State University. I did my OBGYN residency at University of South Florida in Tampa. And I've been working here at Women's Care Florida since August of 2019. One of the most hot topics recently in today's discussion about the pandemic has been the vaccination and what the COVID vaccination can do for you to protect you against the virus, as well as what are the potential risks and side effects. This video essentially is going to be able to address some of the most commonly asked questions and also potentially give some reassurance and allow us to share with you the most recent evidence that we have based on the vaccine. And the original research trials, unfortunately, did not have pregnant women purposefully tested. We don't usually test in this patient population during pregnancy because the risks are unknown originally, and we don't really know what the medication might do to the fetus. And the last thing that pharmaceutical companies want to do is hurt an unborn baby. And so oftentimes in many different research trials, we're not including those patients in the upfront phases. That being said, in the vaccine trials, we did have a number of patients that ultimately did become pregnant during the trial itself, and we were following those pregnancies very closely, and thus far we have not been shown to have any adverse reactions or side effects or anything bad happening to the pregnancy during the actual gestation period itself or even after birth. And that's something that the vaccine trials themselves and the government and different states are very closely monitoring as far as their ability to pick up reactions, pick up abnormal outcomes, pick up adverse outcomes in these pregnancies. And thus far, I have to reiterate what the lead officials on the vaccination and the pandemic themselves, Dr. Fauci and his team have said, which is the information that we have right now raises no red flags whatsoever as far as the risk of receiving a vaccine in pregnancy, which is the same risk that any person, even outside of pregnancy, would experience. And for the most part, what we're seeing is just mild vaccine reactions because we are stimulating an immune response. We also have to look at what COVID potentially could do to you if you were infected during pregnancy. And we know from many research trials that women that are pregnant have an increased risk for hospitalization if they were to become infected with the COVID virus. They also have an increased risk for being needed to be transferred to the intensive care unit and actually need assistance breathing, also known as intubation. And they also overall have an increased risk of having severe outcomes, for instance, such as death. We know that especially in pregnancy, it's not just one person, it's two people that we're caring for. And in order for the fetus to do well, the mom has to be doing well too. Mom doesn't do well, the fetus also will not do well. And so because we are seeing a definite increased risk for these women that are pregnant being infected with COVID, and we're not really seeing any increased risk with complications from the vaccine during pregnancy, we are recommending women in pregnancy become vaccinated with whatever vaccine is available to you. So the vaccine stimulates an immune response that causes increased antibodies. There are different types of antibodies, but the primary one that increases is going to be something called IgG. That's an antibody that lasts in the bloodstream for a long time, and that's generally what vaccinations specifically try to increase is your amount of this antibody called IgG. IgG has been shown to be not only passed through the placenta, but also in certain instances passed through the breast milk, although much less readily than passed through the placenta. Generally, what you're seeing passed through the breast milk is another antibody called IgA, which generally helps to prevent binding of viruses and bacteria in the respiratory tracts. So although we're seeing that there's potential transmission of this antibody through the breast milk, there haven't been any verified reactions that newborn infants are experiencing to this. And in fact, probably what we're experiencing is just extra protection that the infant is getting because they absorb these antibodies, and those antibodies persist in their own bloodstream for a certain period of time, which can help to prevent them from being infected themselves. So there doesn't seem to be any evidence that breastfeeding mothers cannot become vaccinated. And in fact, we recommend that they do.